Welcome to this video briefing for healthcare management, titled Beyond the Ceiling. We will explore strategies for improving patient satisfaction when your organization is already achieving high scores. When your scores are already excellent, standard improvement playbooks often fall short. This video addresses the unique challenges for high-performing teams, including the plateau trap, the mandate for continuous improvement, and the risk of inflating patient expectations. This briefing is organized into 6 parts, guiding you from understanding the high satisfaction paradox to developing a 12-month playbook for durable excellence. Here are the 5 key messages to take away. Focus on variance, benchmark against your own history, segment your data, update your measurements, and remember that true loyalty is engineered beyond the survey. Part 1 examines the high satisfaction paradox. Why is an excellent score sometimes the most dangerous metric in healthcare? Let's find out what it hides. Patient satisfaction remains a boardroom priority because it drives cheaper growth, ensures stickier revenue, and leads to better overall care quality. The economics of experience are stark. From the viral nature of negative stories to the significant financial impact of HCAHPS scores, these 6 numbers illustrate the cost of failure and the reward for excellence. Loyalty is non-linear. Moving a patient from a satisfaction score of 4 to 5 is more valuable than moving one from 2 to 3. This highlights the importance of reaching the zone of affection. It is important to distinguish between satisfaction and loyalty. Satisfaction is a short-term, fragile verdict on a single encounter, whereas loyalty is a long-term, emotional relationship built across multiple experiences. Why do high means stall improvement? We see issues like compressed headroom, the tendency for averages to hide variations, staff complacency, and the impact of expectation inflation. Part 2 focuses on measuring differently. For organizations at the top of the scale, the pivot must be from chasing the mean to actively managing the variance. When evaluating survey items, use the Donabedian lens. Categorize feedback into structure, process, or outcome. Each category requires a different owner and a unique strategy for improvement. The pivot is clear. Same mean, different truth. Even if 2 providers share a 9.6 average, one may have a tight spread while the other experiences an excellence lottery. Shrinking the spread is key to continued improvement. Consider a case study of a rehabilitation institute. Facing high scores and data-poor processes, they adopted a workaround, treating responses as panel data and benchmarking dynamically against their own history. This evidence shows that while performance might be excellent everywhere, it remains unequal somewhere. By identifying relative laggards versus relative leaders, organizations can pinpoint exactly where to focus their efforts. Looking at the spread reveals where patients disagree. When opinions are divided, such as in facility or parking feedback, it flags an, unhappy tale. Conversely, consensus indicates areas like registration, where patients broadly agree. Use the mean and spread action grid to determine your next steps. Protect what you excel at. Stabilize areas with high variance. Redesign underperforming processes and segment your approach to address the unique needs of different groups. Dynamic benchmarking means competing with your own history. By tracking monthly trends in both means and spreads, you can detect shifts in performance long before a standard benchmark alerts you to a potential problem. 4 core lessons for high performers. Recognize that excellence is relative. Monitor both spread and drift. Evolve your survey instruments and actively manage patient expectations in addition to service delivery. Part 3 examines the measurement landscape. With standardization, public reporting, and recent redesigns to systems, the environment for evaluating your scores is changing rapidly. Understand the difference between ratings and reports. Ratings often flatten out, whereas reports on specific experiences remain discriminatory and actionable. At the ceiling, it is essential to use report-style items. The HCAHPS instrument has evolved. Updates include a new care coordination composite, a focus on restfulness over quiet, and expanded collection methods. These changes reset the ceiling, offering early movers a competitive advantage. Recent data highlights the importance of perceptions like safety and teamwork. Items such as able to rest are currently among the lowest performing nationally, representing a new frontier for high-performing organizations to address. Equity remains a crucial frontier hidden inside averages. Identifying variations across demographics like age, ethnicity, or admission type allows you to design pathway-specific care that improves outcomes and scores simultaneously. Listen beyond the survey. Methods like complaint capture, Leader rounding and advisory councils provide direct feedback from the patients who might be the least likely to complete a standard satisfaction survey. Part 4 discusses the transition from satisfied to loyal. Success here involves designing for delight, recovering from errors with grace, and co-producing care with your patients. Apply Kano thinking. Distinguish between must-haves, performance, and delighters. While safety and process are foundational, delighters, like those small, unexpected touches, serve as your growth engine when you are already at the top of the scale. Guestology invites us to study patients with the rigor Disney applies to guests. By understanding the science of needs, wants, and behaviors, you can move from an inside-out approach to one centered on the patient's perspective. You must manage expectations before trying to exceed them. Shaping expectations pre-arrival, documenting them accurately, and ensuring your promises align with your processes are critical for sustained success. Finally, leverage CRM as a satisfaction engine. Personalizing interactions, predicting needs, and deepening relationships can reduce negative experiences and lower costs, helping you stay ahead of the curve in a competitive landscape. Service recovery can be a powerful engine for loyalty. Data shows that if you resolve a failure on the spot, 95% of patients will stay with you. Even an eventual resolution retains about 70%. In fact, well-handled complaints can result in higher loyalty than from patients who never had a problem at all. Moving beyond a recipient model, successful organizations treat patients as co-producers. From involving them in design to coaching them on their own care journey, partnership is a key satisfier. As the Institute for Family-Centered Care notes, families are not just visitors. They are essential partners for safety and quality. There is no path to satisfied patients without satisfied staff. This is the impossibility theorem. It is nearly impossible to sustain high patient satisfaction if the staff is frustrated by the same systemic chaos the patients experience. Invest in your team, and they will invest in your patients. Part 5 explores how culture, leadership, and systems bridge the gap between policy and reality. Excellence must be durable enough to survive on the days when no one is watching, making culture the ultimate safeguard of your patient experience. Policies cannot account for every unscripted moment in healthcare. This is where culture fills the gap. By deliberately designing your values and maintaining consistency between leadership words and actions, you ensure staff know what right looks like, even in the most unpredictable patient encounters. Effective leadership requires 5 pillars: vision, skills, incentives, a robust delivery system, and measurement. Removing even one of these weakens the entire structure. A leader's job is to manage all 5, ensuring the organization remains aligned for both patients and the staff who serve them. Hardwiring service excellence means using standards and scripts as scaffolding, not shackles. Whether it's sitting at eye level to increase perceived connection or standardized scripts that offer comfort, these tools standardize the floor while allowing for authentic human interaction to reach the ceiling of excellence. Sustaining momentum without burnout is the final challenge of hardwiring. This involves publicizing wins, reporting feedback loops, refreshing delighters before they fade to entitlement, and keeping the portfolio of initiatives focused and well-resourced. Remember, initiative fatigue is the enemy of sustained improvement. In Part 6, we outline a 12-month playbook. This sequence strategy helps teams move from assessment to action, and finally, to institutionalizing excellence as the standard operating procedure. In the first 90 days, focus on assessment. Conduct a variance audit to identify where spread is high. Disaggregate your data for equity gaps, and set self-benchmarks based on your own trailing 12-month performance. You cannot manage what you do not clearly see. From months 3 to 9, you act. Execute your grid plays by targeting 1 stabilize item and 1 redesign item. Pilot small, impactful delighters. Empower your frontline with recovery funds, and pair every patient-focused change with an improvement that reduces staff frustration. Months 9 and beyond are for institutionalizing. Conduct quarterly grid reviews, scale proven pilots system-wide, and refresh your measurement instrument annually. Most importantly, recognize consistency, not just averages, and maintain transparency through constant "you said, we did" reporting. A ceiling dashboard tracks the 8 signals that keep your organization honest. By focusing on these indicators, you ensure that your high scores are grounded in real, consistent patient outcomes rather than surface-level metrics. In closing, remember these 7 principles: manage variance, benchmark against yourself, address equity, prefer reports over ratings, delight deliberately, treat recovery as marketing, and always remember that staff and patient satisfaction are inextricably linked. This is how you live above a 9.0. Thank you for joining this session. As you move forward, ask yourself, what would your averages confess if you dug deeper? We hope this playbook serves as a guide for the conversations your scores cannot have on their own.